Dennis Long, Sports Regenerative Medicine. We're going to talk today about a basketball player who tore his ACL and PCL. The ACL is a very commonly injured ligament in sports medicine, very well heard of in football players. When we talk the anterior cruciate, there's two actual cross-like ligaments that provide stability for the tibia and fibula. This is the tibia, this is the femur, and they prevent anterior and posterior translation, so they provide stability. And they're shaped in a cross segment, so the anterior cruciate is here and the posterior cruciate there, and this is depicting a tear in the anterior cruciate. When these tear, it's such a violent injury that usually the parts of the meniscus, which is depicted here, the medial and the lateral meniscus, are torn as well because it's such a violent injury. And so we have had several patients who've had surgery, ACL reconstruction, and it's a very, very difficult surgery to rehab. And some of them are still having symptoms, so a lot of them come to me looking for regenerative medicine options for this. And that's where we tend to help them. Thank you.